Okay, cool. So for this presentation today, I did it on clinical psychology. Now, the first question is, what is clinical psychology? So clinical psychology is a branch of psychology concerned with the assessment and treatment of mental illness, abnormal behavior, and psychiatric complications. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, otherwise known as the DSM-5, was created by the American Psychiatric Association and is essentially a manual containing diagnostic procedures and codes for all recognized mental disorders. I decided to base this project on clinical psychology because I've been a mental health advocate for many years, and it is my dream to eventually obtain my PhD in psychology and become a licensed clinical psychologist. As many of you already know, I run an international mental health nonprofit called the Aikido Legacy Initiative, and I've even created my own versions of the DSM-5. I'd also like to mention just a few of the organizations I have volunteered or networked with throughout the years, such as the Foundry BC, the Youth Advisory Council of BC, the U.S. Centers for Disease Control and Prevention, and the United Nations. I'm also a trained and certified Rising Leader Youth Ambassador for the Tourette Association of America, which basically means that I am allowed to educate members of the public, including the U.S. federal legislation, about Tourette syndrome and other comorbid psychiatric conditions. As a MedCircle member, I also have exclusive access to an entire award-winning clinical psychology video library, and regular invites to exclusive virtual lectures with world-renowned doctors such as triple board-certified clinical and forensics neuropsychologist Dr. Judy Ho, clinical psychologist and professor of psychology at Los Angeles, California State University, Dr. Romney, and double board-certified in child, adolescent, and adult psychiatry, Dr. Dominic Sportelli. If you're interested, feel free to use our legacy code EDU50, that is EDU50, for exclusive discounts on all MedCircle memberships. And I just wanted to point out the thing that was just circled in red there, that is actually my logo for my nonprofit. So as most of you probably already know, because I'm sure you've all seen it before, but yeah. So before we begin, I just have a few disclaimers. So just as a general disclaimer, this presentation is strictly created for educational purposes only and should not be substituted as professional advice. We will not be diving into any trauma-related topics during this time. As a signs and symptoms disclaimer, while learning about these conditions, it is normal to believe that you may show signs and symptoms related to the topic. We will not be discussing specific diagnostic criteria, so please do not self-diagnose yourself during this time. Please consult with a medical professional if you believe you may have something we have talked about today. As a resources disclaimer, a QR code will be shown at the end of this presentation, and I highly suggest that we all scan the code and fill out the quick form, and this will allow you to access extra information on what we discussed about today, and international resources will also be included in that email. ID disorders are the next one. So these ones can be quite complex and difficult to understand, but I'm going to try and break it down as simple as possible to really better understand these conditions. So there are 10 types of personality disorders that are characterized or that are organized into 3 distinct clusters. So there's cluster A, cluster B, and cluster C. So a general personality disorder is characterized as a pervasive pattern of inner experience that cuts across all aspects of life. So of all of these conditions, including the personality disorders, they all cut across all aspects of life, from early childhood to late adulthood. That's typically how it presents. Now, one must be 18 or above to receive any of these diagnoses, as studies show that your personality is not necessarily fully developed until early adulthood. If an individual presents clear signs of any of these conditions, a specifier of early onset personality disorder would be signified in their diagnosis. Now, the first one we're going to talk about is cluster A. So cluster A is characterized by odd and eccentric thinking/behavior conditions. So a schizoid personality can be remembered as a seclusive person, as these people withdraw themselves from society and all social communication. And this is not due to social anxiety. So that's a key point to remember, is that this one is not about social anxiety. They just strictly are just super seclusive and not wanting that social interaction in their lives. So schizotypal personality, super fun to say, by the way, can be remembered as an eccentric person as these people may seem out of touch with reality and completely abnormal in nature. So these people can be, um, think, they're from space, like they're aliens, or they may think that they're carrying baby Jesus in their womb and stuff like that. Now, paranoid personality can be remembered as a suspicious person. So these people may seem malevolent and almost trapped in a paranoid delusional state of consciousness. Now, cluster B are dramatic / unpredictable conditions. Now, antisocial personality disorder is the first one, and it's the equivalent to what most people think as psychopaths or sociopaths. Both those terms are outdated and are no longer used in the clinical setting. A violative person may not have any empathy for violating the rights of other living beings. Only about 50% of those in prison have this condition. So that's extremely important to remember, is that, it's very common in prisons, but there's still the 50% that don't have this condition. Now, a narcissistic personality can be remembered as a manipulative person, and as these people may seek excessive admiration and approval from others without having respect or compassion for other people's feelings. Narcissists have very low self-esteem, which is the fuel for this manipulative behavior. So that's also really important to remember, is that, it's actually quite sad. These people have very low self-esteem, which is the reason why they're manipulative and don't know how to communicate properly to people. And it's quite sad, actually. So a histrionic personality can be remembered as a dramatic person, as these people may seek excessive attention and will feel unease if not in the center of attention. And the last one in this cluster is borderline personality disorder, which can be remembered as an unpredictable person, as these people have an ingrained fear of abandonment and excessive mood swings. So this is different than bipolar disorders, as the mood swings are more frequent and consistent. Because bipolar disorders are typically, their mood swings are typically weekly. So they change like every week or every 2 weeks and stuff like that. But bipolar, borderline personality disorder is more frequent. Now on to cluster C. These conditions are classified as anxious / fearful conditions. So the first one is avoidant personality disorder, and this can be characterized as the feelings of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. So think of this as like the severe form of social anxiety disorder. Now, dependent personality disorder is characterized as a pattern of submissiveness and clinging behavior related to an excessive need to be taken care of. Think of this one as the severe form of separation anxiety disorder. So obsessive compulsive disorder is the last one in all of these personality disorders, and it is characterized as a pattern of preoccupation with orderliness, perfectionism, and control. So basically the stereotyped type of OCD everyone thinks about. So it's a little more, it's a lot more rare than regular OCD, but it's the one that most people think when they think about OCD. So it's kind of interesting that way. Now, psychotic disorders. So first we have to understand, what is psychosis. So psychosis is when someone experiences either delusions or hallucinations and or disorganized thinking, abnormal motor behavior, or negative symptoms. So you have to have either delusions or hallucinations, and you might have something in one of the other three categories, but you need at least the delusions or the hallucinations. Now, to better understand this category of conditions, we need to understand the types of symptoms. So there's positive symptoms, which you can remember it as like add abnormalities. So these are kind of the symptoms that add on someone's state of mind. So for example, delusions, hallucinations, disorganized thinking, derailment, tangibility, incoherence, grossly disorganized abnormal motor behavior, and catatonic behaviors. Then on the other side, there's negative symptoms. So these take away normalities, such as diminished emotional expression, prosody, and so on. They're on the screen there. Now, we are going to go into super quickly on the disorders within this category. So there's brief psychotic disorder, which is basically a psychotic episode, as this is a lot more common than all the other conditions in this category. Then the next one is delusional disorder. So this one is predominantly delusions, but hallucinations can be present in this condition, but they're due to the delusional theme. So anything that is considered a delusion would have to, considered a hallucination would play into the delusion, kind of the type of delusion that they're experiencing. Schizophreniform, another one really fun one to say, is the prerequisite to schizophrenia, as symptoms must persist for at least 3+ months. And then schizophrenia, on the other hand, is 6+ months of continuous psychosis. So the next one is schizoaffective disorder. Now this one, you can remember this one as kind of schizophrenia, but on top of that, there's a bipolar disorder. So it makes it a lot more complex and difficult to treat in treatment. And then the last one in this list is catatonia. So catatonia is quite confusing and difficult to understand, but we can maybe do a little bit more research later, or you guys can ask some questions later. So basically, catatonia can include stupor, cataplexy, waxy flexibility, mutism, negativism, posturing, mannerism, stereotypy, agitation, grimacing, echolalia, or echopraxia. Dissociative disorders. All right, so dissociative disorder is characterized as an intrusion into awareness, behavior, and the inability to access information or to control mental functions. So individuals with a dissociative disorder may either feel a detachment from themselves, which is called depersonalization, a detachment from reality, which is derealization, a detachment from identity, which we call alters, and then a detachment from memories. So this is dissociative amnesia. Dissociative identity disorder exclusively exhibits the detachment from identity, while the other types of dissociation have separate specialized disorders. So the word alter is used rather than personality to distinguish between the distinct states of identity. Multiple personality disorder was rightfully changed to dissociative identity disorder to represent the symptoms of the condition more accurately. So one with DID does not have different personalities, but in fact, during the early stages of development, fragments of one's identity was split into separate identities within them. So co-consciousness is a term used to signify that one with this disorder can be piloted by two identities at the same time. Those with DID are less likely to be violent than those of typical brain structures. So that's really important to keep in mind because like the media always presents people with multiple personality disorder, aka DID, that are very violent, but it's actually very super not true. It's just statistically not true. And so we're just going to talk a little bit about this diagram I have here. So the way that dissociation works and the way that the reason for it is that you're exposed to either a traumatic experience or a stressful experience, and then it goes into that kind of wheel. So you have the fight, flight, or freeze kind of notion of thoughts there. So flight would be kind of like panic attacks or psychosis, where your mind is trying to detach yourself from what is actually going on in your life, like the traumatic experience, the stressful situation. And then fight is more of like severe anxiety or impulsivity. So you'll endure in that stressful experience or traumatic experience, but you'll experience really excessive anxiety or impulsivity. And then the one that everybody forgets is the freeze. So freeze is either dissociation or catatonia. So that's kind of an easy way to remember dissociation and how that works. So yeah, this is a time for any questions here. And this is the QR code that I promised at the beginning. So I really encourage everyone to, either screenshot it or scan the QR code so that you can, and then fill out that quick form online, and you'll be sent an email with all the information, resources, and everything that we talked about today. And yeah, thank you for watching.